11 Kicking started as an effort to increase access to play for children. If you look back at the history of a lot of the African countries, we never had a proper playing ball. We had a ball that was made of polythene bags and just a makeshift ball. So 11 Kicking is actually an effort to increase play for children and to increase play with a ball that can be used in very rough playing grounds, as opposed to balls that don't always last in our fields. So when you have an 11 Kicking ball, it's a leather ball that's durable and made for the African terrain. And the impact of this ball is creation of employment, partnerships to donate balls to children that lack that access, to schools that lack access to a proper playing ball, and also partnerships to upskill in refugee camps. So we have programs in Dadaab and Kakuma where we're training refugees and host community on how to make a ball. The other element is health education through the ball. So we're able to educate using the ball on malaria, tuberculosis, and now we have the mental health program. All this is in an effort to use sports as a mode of sport for development and social change.
Our catchment is a very humble environment. They are coming from families which have a lot of issues, being a slum area, and they are coming to school when they are totally discouraged, and most of them have lost hope. So when the team came in, Alive and Kicking, we have seen a lot that has changed. You've been able to give us balls, you've been able to get information about the mental health, and we have seen a lot of improvement. And it has also made our children to feel they belong.
The reason the program started was because a lot of our beneficiaries felt there was a gap, especially after COVID. Most of the teachers, most of the students struggled with their mental health, and they didn't have anyone who could teach them about mental health or fill in the gap. So we came up with a ball and football drills that would be easy to educate kids with, so that they're able to understand their mental health using a simple tool. And ideally, because sports creates a safe space, then they're also able to play, talk about what they're feeling, and look for ways to improve their mental health.
The project, once we started at Babandogo Primary School, we are able to interact with each other well. The children play with each other, they support each other. The message on the balls that are from the Alive and Kicking is very impactful to the children and also to the parents. We have seen them appreciate their children, knowing that they need to treat them well as the other children who do not have disability. The children who in the school, in the larger school, come and play with the children with disability. They help them even to improve their performance. And therefore it is a very important program, which I think if it is extended to all the schools in Kenya, it will do wonders.
This particular program, we're in 20 schools. With the 20 schools, all of those are schools with disabled children. Each school has a population of about 2,000 to 3,000 children and a population of around 40 teachers in each school. So total, we're seeing an impact of about 10,000, including teachers, parents, community members, as an impact of the program. For 11 Kicking, what we're looking at is methods of communicating to parents, teachers, the community on very important health issues, and finding a way to communicate it through a ball as a tool that creates cohesion in the community. A ball creates a social environment where people are able to discuss very tough topics. So with us, we're using our ball, and a ball that is made locally by us creating employment to be able to create knowledge and to be able to change lives.
Alive and